Hey, good afternoon, Scurry County. It's Dan Hicks, your county judge. I'm wearing a mask. Dr. Cooper is here with me. He's local health authority. And we have Kathy, who's the chief nursing officer out of Cogdell. So we're going to go over some things today, give you an update on where we stand, and it not just affects here, but it's regionally as well, and probably the whole state too. So right now in Scurry County, we have 131 active cases. 931 have recovered. We have 17 deaths, and there's one new death that we're going to report. It's a male, 70 to 80. We have 1,079 total cases, 39 new positives since the last update, 14 recoveries since the last update. Um, with the deaths, I think I've told you before that they're going to the state first, and then they're coming back to Scurry County. And the state is extremely slow on getting that information back to us. So we're not getting those deaths to you as soon as someone passes, because we're not getting them from the state. Sometimes it takes 2 and 3 weeks to get them back. So that's why those numbers look odd. Excuse me. You'll hear about a death. I know that word gets around pretty quick about the deaths, but you're not going to see them posted until we get them from the state. There was a question about who's involved with the meetings that we have. We have meetings once, usually twice a week, to discuss where we stand with COVID in our area here in Scurry County. Cogdell is involved. Kathy's on that call every day. Scurry County, Ira School District, Hermley School District, City of Snyder, EMS, the Police Department, the Sheriff's Department, Western Texas College, the Christian School, the Health Department. So it's not just a few of us, it's the whole community that's coming together, all the leaders in this community coming together to get the information to who needs to have the information, and to kind of give an understanding of where we're at. Talked to Jason Tyler a little while ago with EMS. They are back to full staff just about. They're doing great. They appreciate all the thoughts and prayers that you've given out towards them. So I'm going to stop there, and I'm going to pass it on to Dr. Cooper or Kathy, whichever one of you would like to. We're going to go to Kathy.
Okay. I think we'll start with some of the numbers that we've done with testing at the hospital. In the last 7 days, we've conducted 508 tests. 114 of them have been positive results, so that's a positivity rate of about 22%. And that's an average of over 14 new cases a day. That's 7 days a week. Over the last 30 days, we've done about 1,739. 425 have been positive, with a positivity rate of about 24%. That's probably at least double the state average. And that 30-day average of new cases per day is about 13. So our numbers are really, really high.
Yeah, they are.
And they're not showing any sign of slowing down. The new count today in the last 2 days is 39. So, we're above the average even.
Absolutely.
The last 2 days.
Yeah, it's a lot of numbers. That's too many cases right now. So is that the only information you wanted to put out right at this moment?
I can talk about the region. The hospital situation in the region right now is very serious. If you watch the news at all, you've seen that the Lubbock region, which we are part of, and then the Amarillo region, and then the El Paso region are the hardest hit areas in Texas right now. But there's a lot going on. I'm on calls every week with the trauma region A and B, and that's the Panhandle, Amarillo, and the Lubbock region. And we're having a very difficult time. The whole region is having a difficult time transferring patients out from the hospitals. The rural facilities that need to transfer patients for a higher level of care, they're just not, we're not able to get beds that we need. Not only are we not able to get beds, sometimes we'll get a bed and then we can't get a transport company. It's become quite common for us to have to call 8 or 9 or 10 places to find a facility that will accept a patient. And we're taking patients as far away as San Antonio and Austin pretty routinely. We've had several this week where we've brought a plane in from either Albuquerque or Kansas, and then they take the patient down to San Antonio or Austin. And it's honestly becoming more the norm than not at this point. And that's really scary, because how that, you may not get COVID, or you may think you won't get COVID, or you may think you may get it and not need to be hospitalized. But what this is affecting is everybody. If you need medical care, if you need to go to the hospital and be cared for, it's putting that everyone at risk because you're not necessarily able to get care. It's not just COVID patients that we can't get transferred. It's COVID or non-COVID. It's just beds. I've looked at the numbers this morning for RAC B. That's the Lubbock region, which we are part of. We have 1,380 hospitalized right now, 194 in the ICU, and of those, it's 398 of them are COVID positive. So that's a very large percentage. I think that's around 30% or so are COVID positive. It's a very high rate. And these patients are requiring a lot of care. The hospitalized patients are requiring a lot of care, and their stay is long. They're typically staying, if you stay a week, you're going to stay 2 weeks, and they're often staying much longer than that. So it's not like you get them in and they get out in 2 or 3 days. They're long lengths of stay. So that's compounding the problem. You may have seen in the news yesterday, Covenant set up med tents in their parking lot of the hospital, and I believe they're setting them up today or tomorrow at UMC to help with the overflow. So these are, this is a disaster situation. It's really extreme, and we need to do everything we can to slow that spread.
Amarillo's doing the same thing, aren't they?
Yes. Okay. Amarillo and El Paso. I think El Paso has moved into their convention center with their surge patients. And we are even talking about it here in Snyder, getting our facility ready at the Armory in case we have more than we can take care of at the hospital.
Yeah, we started that process already at looking to make sure that we can do that.
Now, speaking of COVID, in our hospital, we're averaging about 4 positive COVID patients a day for at least the last couple of weeks.
In the hospital?
Yeah, in our hospital in a separate COVID unit. And they do require a lot of care. Not to mention the gowns and all that sort of thing, the respiratory equipment, BiPAP machines, high flow ventilators, which fortunately we have enough barely so far. And I think that our administration needs to be, thanked or congratulated for the amount of effort they've done since it all started, as far as aggressively purchasing supplies for PPE, getting extra equipment for respiratory if we need it, hiring temporary respiratory people to supplant our own. And the doctors that are actually taking care of the COVID is, when it all got started, the younger members of the staff excused the 60+ members of the staff. So currently those physicians that are taking care of the COVID patients on the staff are Dr. Rebecca Burson, Dr. David Kerr, Kevin Huff, Tanner Evans. I'm missing
Morris.
Pardon me?
Dr. Morris.
Yeah, Dr. Morris and Dr. Martinez. And we should all thank them, because the taking care of the COVID people is a real time-consuming and difficult affair, because even though they're still here, they're still quite ill. I'll talk until I can't run out of breath, and I'll pass it on.
Okay.
Dr. Evans, too, I think. Dr. Evans, you mentioned.
Yes, I think I mentioned that. And a quick run through of the natural history or the epidemiology of the coronavirus. Even for 2 days prior to onset of symptoms, you are routinely considered contagious. So the fact that you're interacting with someone who feels well means nothing. The amount of virus in the community, the fact that somebody is asymptomatic doesn't mean a thing. You have to presume anyone is. So another people complain about 2 weeks quarantine after close contact with a known case. That's true. And within our hospital employees, we're up to probably 4 people that have documented positive COVID that were initially negative at 12 to 14 days after last contact with a known positive. So we're not making these numbers up. They're real.
12 to 14 days later, they're starting to get
Yes.
symptoms.
When they're
Okay.
testing positive.
Mhm,
Okay. Wow.
absolutely. And like I said, and for the 2 days prior to symptoms or prior to the positive test, they can be spreading the disease.
Okay.
And so along those lines, I recommend that if you have any contact with anyone outside your household for any reason, for any length of time, please wear a mask and social distance. It is critical because as the numbers that Kathy's discussed, we're handling it at the hospital. It's not easy. And if we start getting where we're having 6 COVID people a day or 30 positives in the community a day, we can't increase forever. And we cannot do anything in the community. It's up to you to take the measures that will reduce the risk of spread, please.
Can I ask you a question real quick?
Sure.
This just occurred to me as you were talking about it. You're talking about masks, wear masks and social distance, and we've been preaching that since day one. However, you have people that don't believe that the masks work. I mean, you have a lot of information out there. You can get, like we've said, you can get the spectrum of information.
Mm-hmm.
There's a lot of information out there that says that masks don't work. I want our local information. What are your thoughts on masks? I know, I think I know what you feel.
No, I think they work.
Mhm.
I think they work both ways.
Mhm.
And as a matter of fact, just in the last day or two, CDC had been part of their statements were that masks protect you from spreading it to others,
Mhm.
but not necessarily a mask protecting you from others. They have changed that. And, as far as common sense or professional experience over these many years, no, a mask is good for everybody in every situation.
Mhm. Okay. You hear some people discuss that it could cause respiratory problems if you're wearing a mask. Is that accurate, or is that?
So far, let's see. I think when this all got started, I heard about one lady in the Northeast
Mhm.
that maybe got a little too much carbon dioxide while driving her car and had a wreck. In our hospital, where people wear masks all the time,
Mhm.
every day, including N95s for hours at a time,
Mhm.
no one has been ill in any way. If you have, I'm sure there's always potential exceptions. Someone that is oxygen dependent with severe COPD, uh, who is living on the edge anyway,
Mhm.
if you hinder airflow with a mask, it could potentially cause an issue. But as far as 99.9% of the population, we have no evidence that it causes any harm whatsoever.
Okay. Thank you. Thank you.
I think that to add to that, the way you wear your mask and what in your hygiene with the mask is important. We've kind of, at the hospital, I see it at the beginning when we all started wearing masks, we were touching them all the time.
Sure.
Because it was a foreign object.
Yeah.
We've kind of gotten used to them and we don't play with them as much, but when you're not used to wearing a mask and you want to pull on it and tug it and whatnot, it's contaminated. And when you take your mask off, how do you store it? Do you just, you lay it down and then someone else touch it, so you have to be careful too with your mask, what you do with it.
Sure. And how you mask that, how you wear it, that's something we've discussed all
Yeah,
along as well. Wear it properly.
If it's not covering your nose, it is ineffective.
Yes.
Okay. We were going to discuss some reinfections and antibody testing as well. I know that has come up.
Okay. In our county, I can think of 2 people that have potentially had COVID diagnosed 3 months ago, and 3 months later get ill and test positive. As far as proving whether or not the initial infection that was diagnosed 3 months ago, proving that was real, and this one is the second one, the state of antibody testing, unfortunately, does not allow that. The CDC does not recommend retesting for 3 months after you have a positive test. After that, with appropriate symptoms, they say it makes sense to test. So there are some reinfection rates, or there are isolated cases of reinfection. It is not common, but it's real. So if you have been diagnosed with COVID that's in or recovered from it, you're not absolutely home free.
Okay. Are the symptoms about the same the second time around, or do we know yet? Or are they more severe or less severe?
Well, actually, the 2 that I'm thinking of had either minimal or no symptoms on the first positive test.
Okay.
And then on the second time, fortunately, neither of them were seriously, terribly ill, but they were distinctly worse than either no symptoms or absolutely or minimal symptoms on the first testing. And Dr. David Kerr, in a conversation with an ER physician whose ethnicity is India, and so this individual has conversations with Indian physicians,
Sure.
and that subcontinent, with their vast number of cases, they have had isolated reinfection as well. And this individual quoted to Dr. Kerr that it appears to be the people that were minimally symptomatic or no asymptomatic on the first infection will be at risk for reinfection.
Okay.
Before I forget, Thanksgiving's coming up, and traditionally it is the season of large get-togethers with friends and family from long distances, having a celebration. Please do not do that. This is just not the time or place to have large gatherings of people that are not routinely in your household. It's just dangerous.
And that's what's causing the spike, isn't it? Is gatherings and being around people, not wearing masks, not social distancing, doing the things we're not supposed to be doing when we're in the middle of the pandemic, correct?
Yes.
You mentioned the regional hospitals. You mentioned the recommendation, and then you mentioned that there's no such thing as allergies. Can you explain that?
Well, obviously there are allergies. However, a very common sequence of events that we have noticed ever since this began was somebody comes in or presents on telemedicine or whatever, and they say, gee, I thought my seasonal allergies, my hay fever was coming back, but I don't feel good at all today. And they get tested for COVID and they're positive. And that is very dangerous, because if you dismiss allergy symptoms as just allergies and you don't know and you have not been tested, then you're out and about and potentially spreading the disease. So, like in jest, yes, there are allergies, but in this day and time in Scurry County, if you got allergies, I think you're COVID until you're proven otherwise.
That makes sense. I've heard that quite a bit myself.
Mm-hmm.
It's really true. We've seen so many, and we've seen a lot of people come in with just one symptom. They just had a headache. They just had a little sore throat. It wasn't even severe, and they tested positive. So you really can't gauge it by the number of symptoms or the severity of the symptoms.
Right.
It isn't a gauge that's reliable.
Okay. That was one of the questions that's popped up here, was do we know what's causing the spike? Another question is, what can we do to slow things down? And that's pretty obvious. We need to wear our masks, social distance, stay away from large gatherings. Is there anything else that you would suggest?
What's the hand washing?
Hand washing.
Continue.
Right, yeah, the hand washing, but, social distancing, avoiding, close contact with people outside of your household when at all possible, is the primary method.
Okay.
I think people eating together, whether it's a restaurant or something, you invite someone into your home to eat, it's a really dangerous situation because of course you're not going to eat with a mask on.
Sure.
You're in close proximity. And the 6 feet, we've said from the beginning, stay 6 feet away, but it's showing as time goes on, it's showing that it's not, 6 feet is not a magic number.
Sure.
And it's really spreading much further than that. So eating together is just one of the riskiest things that we can do. And unfortunately, it's such a social thing and
Sure.
it's important. But it's just dangerous, like Dr. Cooper said, it's dangerous right now.
Okay. Yeah, absolutely. There's another question on here, and this I'll be able to answer this one. Why is there no enforcement of the mask mandate in this town? The governor's order says that there is a penalty. It's $200 or $250 fine. However, it also says that you cannot be detained. So it cancels itself out. So if a police officer stops you and says, I'm going to talk to you about not wearing a mask, that is a detainment. So you violate the order by enforcing the order. And so unless the governor goes and fixes that order, we're not going to be able to enforce that. We're not going to try to enforce that because it violates itself. So what we're asking for is personal responsibility. Take responsibility for yourself and do the things that you are asked to do. There's going to be a group of people that are not going to do it. There are some people that are just not going to wear a mask, and there's going to be a group of people that wear a mask, but they're going to wear it improperly. And then you're going to have another group of people that wear their mask all the time. But aren't there cases of people wearing their mask and still getting it?
Yes, it's possible.
Okay.
Yeah,
But it's less likely.
yeah, a mask reduces risk.
Okay.
And 90%, 95%.
Mhm.
I don't have exact figures, but it
Sure.
reduces risk, but it does not eliminate it.
Yeah, but that makes me wonder if they may be wearing a mask, but are they wearing it properly? Are they touching their mask? Are they?
Well, and the mask helps that aerosolized spread, but there's also the contact spread, which we don't think is as large a component, but it is a component.
Mhm.
So you can touch and spread it that way. So the mask doesn't help in that regard, and that's where the hand washing comes in.
Absolutely. Okay. Well, is there anything else that y'all would like to cover today? It looks like everything that we discussed earlier.
I would like to just mention one more thing that's actually good news, because we have a lot of kind of not so good news right
Sure.
now in this regard, and it's very serious. There is a new treatment on the horizon. It actually was approved this week by the FDA under emergency use authorization. It's Eli Lilly has a monoclonal antibody, and it's going to be a 1-hour infusion that will help people that are ill but not yet hospitalized, and hopefully keep those symptoms from being as severe and keep them out of the hospital. And this is the first treatment for this type of patient that we have. We have a couple of treatments that have shown to be a little effective once you're hospitalized, but this is hopefully going to keep more people out of the hospital.
Sure.
We're hoping to have this distributed in Texas, hopefully maybe even by the end of this week, but soon.
Okay.
I think Texas is near the top of the list for it's based on your case counts.
Mhm.
And so we certainly qualify to be near the top of the list to get that. So I think that's exciting that we have something that, coming to offer as a treatment for early disease.
Yeah.
And I had one thought occurred to me.
Yes,
If you are ill and COVID positive, you're counseled that you should quarantine for 10 days until you get better and your fever goes away. And I want to emphasize that at 10 days is not a magic number. There are a number of people that are ill with COVID, not sick enough to be in a hospital, but they're still sick 2 weeks later. So, if you've been told that your quarantine instructions are 10 days, well, remember it's 10 days with at least 24 hours without a fever, without taking any Tylenol or aspirin, and also feeling a lot better.
I think that's important too, on the recovered numbers that are reported. Those are based on the 10 days. They're not based on we've talked to everybody and they're all feeling better and they've been fever free. So those numbers, it's just a number of 10 days later.
Sure.
And like Dr. Cooper said, there are a lot of people that are still quite ill for weeks, and young, healthy people. This is not just older people who had pre-existing conditions. We're seeing a lot of 30, 40, we've had 20-year-olds in our COVID unit. You know, they're yes, there's more older people with pre-existing conditions, but there's a lot of healthy younger people that are having a really hard time with this virus.
Absolutely. And like you said earlier, it's not just the virus that's the problem. It's the capacities of our hospitals being overfull. And those, well, right now, a lot of places aren't doing elective surgeries because of the spread so bad right now. So some things that well, I know of people that need surgeries that can't get surgeries because of what's going on. So
I think it's so important to remember that, our healthcare providers, we are a limited commodity. You can't just go get more people to be a nurse or to be a physician. It's a very long process. And like Dr. Cooper said, our staff has worked hard and is continuing to work hard, and we'll do our very best to take care of everybody, but we are a limited commodity and we're human beings and we're tired.
yes, I know y'all are. And I can't tell you how much I appreciate everything that y'all have done over these last months since March, when we started seeing all of this. It's amazing the people that we have, not just here in Texas and the United States, but in the world, that are working on this so hard every day, living this. So thank you both for everything that y'all do, and thank the staff out there where y'all are at. Appreciate y'all coming in today. Is there anything else that y'all feel like we might have missed?
No, I don't think so.
Okay. Well, thank you all. Appreciate y'all listening, and just do those things that we need to do. Let's slow this spread down, especially right here in Scurry County. So thank y'all, and y'all have a good day.